All right, let's go ahead and dive in and let other guests join us as they come. Good morning, good afternoon. My name is Grace Rubenstein. I'm the editorial and communications director at HealthBegins. I'm very pleased to be able to welcome you today for this conversation on reimagining financing and capital flows for health equity, with lots of insights coming from a really powerful day that was hosted on February 19th at UC Berkeley School of Public Health. Next slide, please. All right, so just a few kind of housekeeping reminders as we get started. So please know that this webinar will be recorded, and we will be sending out the recording and the slides to you afterwards. So you don't have to feel you need to write down every single thing. You can be present with us, and we'll send you those details by email afterwards. As participants, your lines are going to be on mute for this hour. But that said, we really value having a lively and engaged conversation. So we encourage you to keep that conversation going in the chat throughout the hour. And if you do have a question you'd like to ask of the panelists, we encourage you to put that in the chat at any time. We will be in there keeping an eye on things and making sure we capture those questions as they come and save them to put as many of them to the speakers as we can. So just to make sure we're all ready and warmed up for that, let's try it out. I will start in the chat. Make sure you open your chat pane and click the button to send to everyone. And just drop in your name, your organization, where you're coming from geographically today, just as a way of saying hello and inviting everybody into the conversation. Let's give folks a minute to do that. It's always fun to see where everybody's coming from. Heidi in Wisconsin, hello. We have Washington, D.C., North Carolina, with more Wisconsin. Hello, Wisconsin, Ohio, Oakland, Los Angeles, Indianapolis, Winston-Salem, Minnesota, Maine, Sonoma County, Ohio, Vermont. Wonderful. This is a really widespread group, and that just shows how applicable this subject matter is everywhere. So last few bits of housekeeping. This is a 1 hour conversation. We ask that everybody bring respect, curiosity, and joy to it. You are absolutely welcome to share in the chat resources that are useful to everyone. We ask that you not use that space for any commercial promotion. And let's look at our objectives for today. Next slide, please. And thanks to my colleague, Bobby Long, for managing those slides. We can go back one quick step. Thank you, Bobby. So just for folks who are new to HealthBegins, HealthBegins is a national mission-driven consulting firm and field catalyst, helping Medicaid-serving health plans, health systems, and CBOs to advance health equity, address social needs, and to transform the upstream conditions that put people and communities in harm's way. You can see that over the years that has included helping quite a number of leaders and organizations and communities across many geographies to design and implement strategies and partnerships to move upstream, to improve health and social outcomes, and to advance health equity. Next. Okay, and so our objectives for today, what you can expect by the end of the hour, is that we're going to describe why leaders across the country convened on February 19th, the source of today's conversation, to reimagine financing and capital flows for health equity. We intend to explain a range of innovations that can help unlock and align financing and capital flows for health equity. And finally, we're going to identify some concrete opportunities and near-term actions that you can take with your organizations to help unlock and align financing and capital flows. Next, please. So just briefly, the way this hour is going to go, we'll have a welcome and opening remarks in just a moment, some reflections on the convening from February 19th. We'll review barriers and proposed solutions. Then we have some dedicated time for a Q&A in which we will be trying to bring in some of your questions from the chat. And finally, we'll wrap up with some concrete actions and opportunities to carry us forward. So with that, next, please. It's my pleasure to hand the reins over to HealthBegins CEO, Rishi Manchanda.
Grace, thank you so much. And thanks to all of you for joining. It's so great to be with you today and really excited for this conversation. I'm Rishi Manchanda, I'm CEO at HealthBegins, and I'm one of many people who is involved in this convening last month that we're here to give you a readout about. Let me start by just giving a quick picture of why we convened last month. Why did we convene leaders? If you go to the next slide. I'll say that last year, I was thinking deeply, along with my colleagues at HealthBegins, about our practice areas, including the ones you see on the screen here: investments, integration, power building, and policy. In the investments area, we've had the privilege of working with a number of organizations and leaders to think about how to better find and fund and measure what matters, including developing blended value models and other ways to capture financial, economic, and social value for the work. But not unlike others who are in this space, those who provide solutions and provide support to organizations and communities, we were coming up against a lot of the systemic challenges that many of you have seen. So if you go to the next slide, I'll just illustrate some of the systemic challenges that I started to map, the barriers that hinder financing and capital flows. Financing and capital flows to the populations, the programs, and the places that need it most. And there's a whole host. I'm not going to go through this in detail because, as many of you know, these are complex issues. But what I've done here is to showcase how I was starting to kind of make sense of the challenges from the left, the most institutional level, kind of meso challenges of how do we actually do better financial modeling, capture the ROI, so to speak, of the work that we're doing in ways that matter to our communities. How do we do more sophisticated financial planning and analysis? How do we start to pool resources through collaborative financing and funds? How do we get better governance and accountability of our financing and capital stacks? How do we even look at public provisioning of services so public capital is aligned with public goods? And how do we even go further upstream to look at how to shape the political economy of health itself and reimagine ways to be able to put people first? There's no shortage of challenges here, but what I also saw as you click one more slide is that across the ecosystem, with many friends, including many of you on the line here as well, there's been a number of innovators, a number of implementers who have already tried, in some cases tested, and helped spread solutions to each of these challenges. And you're seeing just a snapshot of some of them here. So the question was, with the solutions that exist, the innovations that I know I've come across for a lot of these challenges, what's holding us back? If we go to the next slide. Part
Sorry,
of
Rishi, I think we lost our slides for a sec. I'm going to try to get them.
I see them on the screen. I see
You
them
do?
on. I do. Yep. Everybody else see the screen emojis?
Yes.
Just me. Okay, carry on.
Awesome. So with those in mind, look at all the emojis. Wonderful. Thank you. So some of the reasons that these challenges seem intractable is because they're rooted in deeper trends. If you click one slide, if you click again, these trends are enabled by deeper structures. This is for all my systems-based thinking friends out there. I see you. This is the slide for you because those structures are also rooted in deeper, next click, worldviews and mental models that help reinforce these things. We're not going to belabor the point over here right now, but if this resonates with you, if you're thinking as a systems thinker and you're like, what is it that's preventing us from getting the money to the people that need it most and to the programs and support we need it most in healthcare and public health and social services? I hope this resonates with you. So it was with this that I came to Claudia Williams, the Chief Social Impact Officer we're going to hear from in a moment, who leads this incredible impact fellowship at UC Berkeley School of Public Health, and said, Claudia and Fred and others at the social impact team, I would love to work on this project to think about how we can convene folks to tackle these systemic challenges. Pretty ambitious idea. If you go to the next slide, what came out of that was a convening in February. A convening in February that brought together some remarkable individuals, many of whom are on the line today, to start thinking about how to reimagine financing and capital flows. If you go to the next slide, we convened really with one purpose. The purpose was, regardless of background, regardless of level of experience or familiarity with financing or capital flows, regardless of whether you're an innovator, implementer, a policymaker, a practitioner, an academic, a community leader, regardless, we had one purpose, which is to unlock and align financing and capital flows for the places, populations, and programs that need them most. Can we think about what to do in that regard? And if we go to the next slide, I want to show you a video actually that encapsulates what we did before I turn it over to our opening remarks from Claudia and then from Chelsea Cipriano. Well, I hope you all heard the video that and the audio that I just heard. Do you guys all hear that emoji test again? Lovely. Can I just say that itself was a small miracle? If you guys know Zoom World, just pulling off a video and audio itself is no small feat. Bobby, thank you, and comms team, thank you guys for that. Um, it's with that I wanted to, yeah, we can go to the next slide here. I'm going to tee up Claudia. It's with that kind of quick synopsis of what happened that I want to set the stage, really set kind of an appetizer for the conversation to come. And I'll start by saying that this would not have happened, as I alluded to earlier, if it were not for the willingness of Claudia Williams and Fred, Dylan, and others, D. Michael Liu, the UC Berkeley School of Public Health, to say yes to this idea, and let alone to the idea of partnering to convene this. Claudia, I wanted to open it to you with my gratitude, but also to ask you to share any remarks about the day and anything else you want to share about the social impact work that you do.
Sure. Thank you so much. It's so wonderful to be on today. I'm seeing the names flow by, bringing back memories from both recent things I've shared, but many years ago experiences as well. So thank you all for joining. I just wanted to reflect a little bit about the broader context in the world and also at UC Berkeley of this important work that Rishi and others have taken forward. I think first of all, as a university, and really our chancellor, our dean, are taking this forward in big strides. We are committed to being a force for change and growth and positive health building in the world, not just education, not just research. And so the Impact Fellow program, and I'll talk a little bit more about that, is really one of the key aspects of our attempts to bridge between the world of knowledge creation and education and the world of impact, and really strengthen those connections so that we can solve the challenges and take advantage of the opportunities in front of us. And I think if there's one thing clear in this moment, it's that the old rules, the old paths, the old assumptions are not going to serve us, and that we need to reimagine what's possible as we move forward. Sometimes we're reimagining in a world of great challenge and great obstructions to the goals that we see. And sometimes we see new light, we see new possibility, and both are part of the truth of where we are today. And that means putting together concepts like equity and finance that had previously been siloed, that really didn't have a lot of connective tissue between them. It means finding space to connect and reflect in community, not just on our own. And it means bringing the urgency of building to our work in partnership. So we're not getting together just to talk, we're getting together to build, we're getting together to create. And I just really want to applaud Rishi and Chelsea and Fred and everybody who made this day possible, because you brought this together in spades. And in fact, this is the goal of the Impact Fellowship Program at the Berkeley School of Public Health. It's a year-long chance to really build, create, reflect in community with up to 9 other fellows. And Rishi, through this event, through this convening, through all the work he's doing, really demonstrates those goals of connecting, reflecting, and building that we hope will be a launching pad for so many other things in the world. And so I'm taking this small minute, and we'll be sharing those links online just to encourage any of you for whom this might be intriguing to think about applying to be a fellow next year. The application deadline is March 31st, and you'll see the link in the chat. But we are so proud, and we're so happy to be a small part of the platform for this collective work, and just are so grateful to all of you, but especially to Rishi, Chelsea, and Fred for making this happen. So thanks so much for giving me a chance to share.
Claudia, thank you so much. I'm going to shower you with my heart emojis here. Real gratitude to you. Thank you for all the support. And as you're seeing in the chat here, Visem's put in the chat to the UC Berkeley School of Public Health Impact Fellow program. If you want to learn more about this year's cohort, including myself, as well as the application link, you'll see that in the chat. Can't endorse it enough as an incredible opportunity. Let's go to the next slide here and extend this gratitude to my friend Chelsea Cipriano, Managing Director at Common Health Coalition. Chelsea, welcome. Common Health Coalition was a collaborator for this wonderful convening. I want to turn it to you to first let people know more about yourself, Common Health Coalition, and then really to say, with the Common Health Coalition's kind of mission in mind, what was it about this event that made you interested, and what surprised you most about the day? and welcome.
Thanks, Rishi. Really excited to be here and grateful for you creating the space with Claudia and with Fred and others. But, really quickly, I'm Chelsea. I'm the managing director of the Common Health Coalition, as Rishi said. CHC is a relatively new kid on the block here. We've only been around for about 2 years, but we are now the largest multi-sector health coalition in the country. Essentially, we bring together healthcare and public health orgs who know that the only way to improve the system is to do so together for the people we serve. And so, if that resonates with you and you lead a healthcare or public health organization, or you're a part of one and you want your organization to join the coalition, shameless plug, it's free. Come join us. We're doing cool work like this and others to really try to drive, that sentiment that Claudia shared, which is we need to do things differently and we need to do things together. So thanks, Rishi, for that moment just to explain what the coalition is.
Chelsea, I'll just say, if you want to, Bobby, can you advance slide one more
Oh
slide?
yeah, sorry, forgot I had a whole slide about this. Well,
Yeah.
there you go. There's my slide. Sorry, now you can look at it. We are commonhealthcoalition.org, so check us out. Feel free to hit me up. You know where to find me now because you're on this webinar. But yeah, would love to have you. Um, the question about number one, why was this something we were interested in and what surprised me? Man, this is a main priority for the coalition this year. The reality is we can't philanthropy our way out of this. We can't look at the existing budget environment from Medicaid cuts to budget priority shifts to staffing shortages across healthcare and public health and the social sector and say, yeah, that's fine. We can fill this gap with philanthropic dollars. We can't. There aren't enough. And so the way that we need to think about this right now in this moment is exactly what Claudia said. How can we do this differently? How can we come to the table with different players while acknowledging that there are many folks who are on this call right now who've been working on this for decades, and have learned a lot of lessons that can't be ignored or not implemented. We can't come into this thinking that we're recreating the wheel in this space, and really mobilizing those lessons for action. I always like to say that, not lessons learned, but lessons mobilized. And how do we build off of what's worked, learn from what maybe hasn't or didn't work at a different time, and acknowledge that we're in a completely different environment right now. And different factors are at play in the health ecosystem. And how do we use those to our advantage to try to advance some new work? So, building off of what's been done, thinking about what could be done differently, and doing it together. And you're going to hear me say that again and again in all the examples that I talk about today. But that is also kind of where I came from in terms of what surprised me about the convening. I mean, first of all, it was just wonderful to be in community with so many brilliant thinkers, many of whom are here today. So I'm so glad that others get to join in that community. But really, I was like, oh, there is so much more innovation out there happening in these pockets, in these little caves that we often stay in by ourselves in our different sectors, that I wasn't aware of, that, I heard time and time again throughout the rooms. I didn't know that was happening. Hey, cool. Like those moments are so special. And I think it's only when we bring people together that we are able to acknowledge that this work is happening. It may be fragmented. It may be more fragmented and siloed than it should be. And people don't know about it. So that's great because we're not starting from square one when it comes to shared financing. We're starting from from square eight. And that's awesome. That means that we don't have to waste time on square 1 through 8. So yeah, I was really impressed by that. Happy that we're all bringing this together now. And the other thing that I was really blown away by was that no one needed to be convinced that this was important right now. There is a moment of urgency that I think we are all feeling when it comes to being able to best serve patients, communities, families, everyone that we all touch and center at our work in our work, that right now, in order to do that work, in order to do it better and better serve people's needs, we need to pay for it together in a different way. And so that was the other thing. No one needed to be convinced that this is important or that it demands the urgency that, Rishi, I'm so grateful that you are bringing to this moment in time. So Anyway, those were my key takeaways. Very grateful that we had a neutral convening space to do it, and that everyone was together with the accepting of there's more to come, and this can't just be like a one-time conversation that stays in this small room of people. It needs to be brought to a bigger tent, and here we are. So, thank you. Hope I covered everything.
Chelsea, absolutely, yeah, and I think it teed up nicely. If we go to the next slide here, you actually teed up really nicely and beautifully, like some of the key takeaways from the convening. And I want to just underscore what you shared and with what's on the screen here right now, and then use this to tee up a few other voices that we have from folks who are at the convening. So everybody on the line here who was not able to attend this meeting could get a sense of what really resonated with folks briefly, and then we'll go into the rest of the readout. So one of the key takeaways, Chelsea, you mentioned was just that, right? We're at square eight, not square one. There's a lot of innovative solutions that are out there to unlock financing and capital flows for health that have actually been tried. There's some new ideas that have not yet been tested, but a lot of the new ideas are just built on the stand on the shoulders of older ideas that have actually been tested and implemented. Um, and some of these include new ways of raising capital, sourcing capital, including looking, for example, at is it possible to look at pension funds? Jim Hickman, if you're on the line, Jim brought in some really wonderful ideas about tapping into some of the largest state pension funds as potential sources of capital and brilliant ideas about how to unlock that source. New ways of aligning capital. There are also folks in the room who are health economists and actuaries in the room. You don't hear that a lot in conversations these days in public health or population health kind of spaces of bringing in actuaries and finance experts and health economists into the room to start talking about common ground. And when we did, we actually uncovered all sorts of existing and emerging ways to define and measure returns and value in new ways. We also heard a lot of innovations that have been tried in the past and are being tried now and are being proposed to pool resources, to stack capital, different sources of capital so that they're aligned and therefore can be better coordinated or orchestrated, especially to support collaborative and community-based efforts. So a lot of collaborative financing mechanisms that emerged as well and innovations. We don't lack innovation was the second big takeaway that occurred. And for those who are interested in learning more about these innovations, by the way, this is my cue to my colleagues at HealthBegins. If you wouldn't mind dropping the chat to our Social Needs Investment Lab site, where we have some of these innovations. Several attendees, many attendees, over nearly a third of attendees who came to the convening in February, shared some of these innovative ideas even before the convening. But what you'll see here in the website is some of the you'll see links to a table that we created just to summarize some of the many ideas that are out there, and there are dozens of ideas that came forward. So if you're interested in learning more the innovations, you'll find resources in the link. And what was clear is that we don't lack innovation. We lack the enabling infrastructure so that these innovations can spread. If you click one time, Bobby, we use the analogy of curling, the winter sport of curling, as a way to kind of describe this. If innovations are the stone that some people see in curling, if you're familiar with that winter sport, what we lack is not enough of the stones that are out there, the ideas that we need to unlock capital. But what we lack is the infrastructure, including things to sweep the ice, to clear the friction points for these innovations to really spread and get to their target destinations and communities. That analogy had surprising resonance with folks. Some people actually unlocked that and said, well, it's not curling that we're facing, it's actually ski racing. So there's a whole bunch of competing metaphors that helped unlock people thinking about ideas to change the infrastructure, and we'll get to that in a minute. And it also became clear that we need more common space to support and connect this work. If you just advance slides. Let me showcase a little bit of the innovations here and then invite some voices in the room, just to give everybody who was not there the readout about the kinds of innovations we discussed. We had one work group that showcased a number of innovations to define and measure value better, returns better. That was the financial modeling group that looked at actuarial standards, new financial modeling methodologies, and cost effectiveness analysis, or CEA methodologies. We had another work group that was looking at collaborative financing mechanisms and structures, new ways to pool and align and stack and coordinate capital in communities for common health objectives. And then we also had a group that was talking about new ways to align and reimagine health insurance and how anchor institutions as well could help support prevention of public health. A lot of the innovations, if you go to the next slide, you're going to see these again in the links that are in the chat. This is just a snapshot of some of the innovations that were shared before the convening itself. on the left, the measuring and paying for value ideas, new service and integration models that show great financial, economic, and social value. The next slide, there are innovations for alternative financing mechanisms, as I mentioned, including the CAPSHI strategy that Len Nichols and Lauren Taylor developed in 2018, the investing and flourishing model that Tyler Norris and team are working on as well right now, and a variety of other incredible ideas. The Prevention R&D Fund from Jake Siegel, impacting investing for aging from the Scan Foundation ideas, as well as on the right, place-based and community investment kind of ideas with folks like the wellness fund ideas, the 1% asset allocation pledges from Healthcare Anchor Network, and Health Enterprise Zones, a model from Maryland that's proven to be effective. No shortage of innovations that were shared. So if we go to the next slide here, with all of these innovations, let me open the mic up for maybe 3 or 4 friends who were actually at the convening to share just brief remarks, about a minute each, if you don't mind, to answer these 2 questions. What stood out most or surprised you? And what common themes did you observe? So I'm going to start first with Tyler, but Tyler, before I ask you to go, I'm going to ask anybody else who is at the convening itself in February, who is on the line today, just to kind of raise your hand so I can see who else is out there, so I can call on some of you as well. But Tyler, why don't you start us off, and welcome, my friend.
Thank you, Rishi. Good to be here with all of you. I want to thank you first, you and the team at HealthBegins and UC Berkeley, for such a successful gathering. It was innovative in its design. It was relationship centered, which contributes directly to field building. And this follow through really matters. I think that in terms of what really stood out is such a strong sense that so much is known about what works and an evidence base on interventions that can create outcomes for youth and family and communities and food and housing, pick your flavor. We know all that stuff. But that if we're committed to a population level outcomes change, we've got to figure out this sustained financing with enough dose, reach, intensity, and duration, and that cracking this financing business is the rate limiting factor. I felt a really strong interest in establishing this cross-sector common space, Rishi, that you're speaking to bring together leaders from all of the sectors to spread the innovation, get smarter together, advance policies and practices to unlock capital flows. I think that was right on the mark. And we were really heartened, the Investing and Flourishing team, around our outcomes-based finance initiative, around what you've already spoken to, which is the innovation of stacking shared savings agreements and revenue agreements to get past the single issue social impact bond, get past this sort of pay for success wall that I think many of us have run into. So we're really, I'm just thrilled about how you brought us together, and you certainly contributed to Investing and Flourishing. And I appreciate the interest in that too, about how we build the infrastructure for this missing market, the kinds of elements that are needed to make this sustainable financing go. Thanks for letting me add a few comments.
Tyler, thank you. And Tyler, as you share, I'm going to go, Jim Hickman, if you're ready. I can see you on camera, so I'll give you a minute. But Tyler, please do something that I want everybody else to kind of model as well. Whether you attended the convening or especially if you did not, if you have a project you're working on, an innovation that is thinking about new ways to unlock and align financing or capital, drop the link in the chat now, because what we did in February and what we're doing today and what we're going to need to do all together going forward is to find new ways to connect so that we don't feel like we're isolated living in the caves, as Chelsea said, in our own sectors. There are brilliant ideas that are out there. Many of you on the line have one as well. So drop the links in the chat as well. So for ideas, links to resources, please share all of that, and we'll do our best to compile and share those with everybody afterwards. Tyler, thank you. Jim, you were at the convening. You played a role as a facilitator as well. What stood out most to you? What surprised you? What common themes did emerge?
Well, it surprised me how much we could all talk about finance without having finance backgrounds, first of all, which was, important in a lot of ways. I think, to echo what everyone has said and what Tyler just put a fine point on is there's no lack of will, there's no lack of skill, and there's no lack of capital, right? So what's left to unlock? Right. And I think that was the sort of charge I felt coming out of the meeting. Like, the only barrier, my phrase of the week is orchestration. We just need to orchestrate this and make it happen. So thank you for bringing the band together, Rishi. That's going to make this happen. So appreciate you.
Strum your guitar a little bit more though, Jim, on the pension fund idea and the work that you're doing. Go ahead and just give a plug for that.
Hold on. Sure, sure. So 30 seconds or less. I was sort of in New Mexico at an event. New Mexico has a sovereign wealth fund where, if you have been following the headlines, that sovereign wealth fund is now providing universal child care to citizens in New Mexico. I was at a convening with a small incubator I work with, and the head of their state investment fund was there just announcing the latest investment into venture capital funds coming into New Mexico to create a startup ecosystem, particularly for healthcare. And I said, geez, if New Mexico could do this, why can't California? And not wanting to drill oil wells, additional oil wells in California or off the beaches of where I went to school, I said, there's got to be other pools of funds around. And that was when I discovered that CalPERS, which has about $560 billion in assets, CalSTRS, another couple hundred billion. So we have close to $1 trillion in retirement assets, public assets in California, where you need a policy change to get them to think differently about how those assets are deployed. Long story short, CalPERS did us a solid. They adopted a policy called the total portfolio approach, which allows you to add other considerations when you select fund managers to invest those dollars. And so I said, why don't we add a question to that rubric that says, how are the funds you're investing in, the companies you're investing in, improving the Medi-Cal infrastructure and delivery of healthcare in California? Simple question.
Yeah,
And
I think
and ideally that shifts the way capital, and people will get additional points on a rubric if they can demonstrate that, and suddenly you're opening capital flows.
love it. Jim, thank you. And I'm going to tee you up to also put any links that you want to that brilliant idea in there as well, not just because of its relevance for California, but what it illustrates as a model for other states, as you said, New Mexico and others that are already thinking about this, and how others in the public health and healthcare space can maybe leverage that. I know there's public health bonds that Common Health Coalition was kind of advancing. We're going to put those links in the chat as well. Maybe one or two other kind of more voices here just to get attendee reflections, and we're going to move on just to continue with the readout, because there's so many great ideas. And please know, for all of you, we're summarizing all of these, and there's already a link to some of these innovations at the sites provided. Fred, I see your hand up. Did you want to share just reflections? What stood out most to you, surprised you?
One sec. Yeah, hi there, everyone. There's so many things that were exciting about this, but in particular, just the partnership that made this happen. I just can't speak highly enough about Rishi, you and your team, and the Common Health Coalition. All of us coming together to make this happen was just a delight. The other thing I was really impressed by was, as you mentioned, and I think Chelsea mentioned this too, of people being willing to come and just saying yes. We were so impressed by the number of people who actually made it. We often put on events at the UC Berkeley School of Public Health, and we often plan for at least a 20%, drop off rate. And then for this particular convening, we had nearly 100% of people who said they were coming show up, which is really amazing. And I just think it shows the hunger for these conversations, the importance of these conversations. So just really want to thank everyone who was able to attend and be part of it.
Fred, thank you. Last but not least, I'm going to ask either Claire, Devin, any other students who are involved in this to let me know if you wanted to share just a brief reflection. What stood out most to you? And the reason I'm doing this is because for those who are in the line who are current students, and for those who are former students, one important ingredient for this convening, and I think is going to be an important aspect of how we can unlock capital and financing going forward, is of course to involve the future of the workforce itself in this. And so I don't know if Claire is tuning in from class. Never mind. So stay seeing in the chat that the students who are online are actually tuning in from class. Stay focused on your classwork. That's great. All right, let's move on to the next kind of slide over here right now, and just say, for those who I didn't call upon who were at the convening, please share reflections about what stood out to you in the chat as well. What was wonderful, and you can really get a sense of it now, was a lot of the innovative ideas and brilliant kind of concepts, some things that have been tried in the past as well, that we need to learn from, not just like the bright, shiny kind of promise, but also the really thorny challenges that take place, the complexity of some of this work that many folks have tried. And it was in that regard that actually a lot of folks came together to start to identify barriers that can really come in place. So some of the barriers that emerged were three sets: policy barriers, barriers in terms of industry practices, standards, and norms and then accountability mechanisms. Chelsea, I wanted to turn it to you just to add your context to this. What were some of the things that really stood out to you, both on the innovations that kind of came out that day specifically, but also, some of the barriers. You had talked before, I think, when we were at the meeting about even the barriers in terms of cultural norms that exist in the industry. I wanted to give you a space to share more about that.
Yeah, thanks. I think that this will feel familiar to folks that we've got some cultural norms in place around in all of these spaces, public health, healthcare, the social services spaces, where I think that we have operated in a place of scarcity for a long time, not just now. This isn't new. Obviously, we've all been through these boom and bust moments, but that scarcity mindset often leads to a lack of courage that I think that we're seeing in many spaces right now. And so there was a discussion about courage, about the need for not just innovation, but the courage from leadership to do it, to put it into action, and to make sure that leaders really feel like they have what they need and the backing to be courageous. And that's not just, political big P, little p backing, but really, do they have the dollars, the rationale behind it? Do they have the ability to show that these innovations will or likely will do something? Do we all speak the same language? The answer to that question is no. I live in this space between healthcare and public health. We don't speak the same language between those two spaces. And there are a lot of artificial barriers that have been built because of it. And so I think, we'll talk about this later, but how do we use things like modeling, both like very deep actuarial modeling, but just in general, like modeling for impact that we know decision makers, particularly who are holding the dollars, need to see? And how do we build that into our vernacular now versus in a crisis or emergency when things are really going wrong? So I think that was one of the biggest things to me, is that we just need to make sure that people feel equipped with the tools, resources, common language, and then the courage to actually act on a lot of these big ideas, because they may seem scary, particularly in a time where there isn't um, an appetite for a lot of risk. How do we reduce that risk by sharing it across different entities and by identifying ways that we can do things together, so one entity doesn't feel like they're sticking their neck out in an unsupported way? So that was a big takeaway for me.
Really appreciate that. Chelsea, you also mentioned there was an innovation that earlier I kind of didn't give you a space to talk about that. Is there any, speaking of those barriers, especially when it comes to some of the modeling work that you've seen and that you've helped to support right now, I wanted to give you a space also to highlight
Yeah.
modeling as an example of like both the opportunities as well as some of the challenges you just described.
Thanks. Yeah, I appreciate that. Yeah, so we are working on this as like a big area, as I said, for the coalition right now. We, not as the coalition, but when Dr. Choksi, our chair, Dave Choksi, and I were at the New York City Health Department during the COVID pandemic, we piloted an innovative approach to shared financing. We colloquially call it the public health bond approach, which my colleague Michael put in the chat, a recent op-ed that Dave wrote about this with Judy Monroe from the CDC Foundation. But we piloted this where we brought payers to the table. We brought multiple payers, 7 payers. We brought the health department, of course. We used FEMA dollars. And then we also brought in providers, and we increased vaccination rates and used a shared approach, sharing money and data really to drive uptake in COVID-19 education and resulting vaccination rates. But I think this public health bond approach, how we've described it and how we're trying to pilot it now in several communities, so happy to talk to those who may be interested, is really a three-pronged approach between philanthropic seed dollars, a public health entity as the operator and the implementer, and also sharing the cost burden, and a payer partner or a health system partner where they're all sharing this risk because they're driving towards an outcome that they all see benefit in. So whether it's HIV or another infectious disease or a chronic disease, where we can show measurable improvement, either process metrics or actual improvement and avoidable costs within a year to 2 years, that is something that we've heard appetite about. And we're able to model out the cost savings in big numbers, not the actuarial cost savings, fairly quickly, so that payers or other interested parties say, yeah, I see the benefit in this. Let's talk more, get them on the hook to talk more, and then we can start these innovative approaches. I do think that the calculating of ROI and the modeling, which you'll get into later, really, really doing so from real world perspectives and what resonates with these decision makers is a gap right now in what we're doing, because we often can't move fast enough or don't have the practitioner perspective built into our modeling. And so that's another thing that we're really trying to change through the coalition. And so happy to talk about our recent measles work, or we'll put that in the chat as well. But that's a bit of what we're trying to advance. Please read that op-ed if you're interested, and happy to talk more. We're all about trying new things over here.
Chelsea, thank you so much. The work that you're doing with modeling, and much like Jim, what you described in terms of, it is spectacular, and much like Jim, you're describing in terms of new sources of capital potentially to help align with healthcare and even public health infrastructure, entirely the new ways of stacking capital and shared savings agreements to be able to unlock capital for common purposes and communities. These are all kind of illustrative examples of similar innovations actually in the spaces. For each of your ideas, there's what we saw at the convening, and what we're seeing, I'm sure, in the folks online, is that there's related kind of ideas that are out there, right? New ways to model, new sources potentially of capital to unlock and align, new ways to pool and stack and coordinate resources. The barriers that exist are not to individual projects, right? They're barriers to each of those types of innovations. And so if you go to the next slide here, Bobby, what I want to tee up and really build on from what we've heard so far is part of the readout about what happened that day, which was on February 19th, which was, I think, a remarkable achievement because of all the people in the room. Not only did folks come together to connect and build relationships, some cases start new relationships, but they also started to reimagine the enabling infrastructure, how to sweep in front of those innovations, right? Those types of innovations to pave the way for financing and capital. What are the policy and regulatory incentives that we need to help reimagine infrastructure? What are the industry standards or practices that we need to reform or generate to unlock capital? What are the accountability mechanisms we need? And what was remarkable is, if you go to the next slide, you'll see that a little snapshot of some of the concrete opportunities that emerged just within a half day, the latter half of the day, by the folks in the room here. And what I think we're going to show you are draft recommendations. These are drafts, these are not final yet, but you're going to get a sense now of 16 concrete recommendations that came forward. And I'm going to let this sit on the screen for a little bit. I'm also going to drop in the chat the link that was shared earlier to the PDF that actually summarizes this. So if you're trying to strain your eyes, don't worry. Just go to the chat, click on the document, and you'll actually see the draft opportunities and recommendations that emerged from the folks who were at that convening. They range from common evaluation frameworks and decision-making frameworks to help people in public health, healthcare, and the social sector start to come together around similar ways to do valuation, right? Not just evaluation, but valuation, right? Assigning monetary value to social, economic, and health returns. Different ways of being able to support pool investment resources. And if you see the next slide over here as well, like examples ranging from new ways to use agentic AI to help support community financing, to new ways to shift the narratives, as well as even governance kind of mechanisms as well. So for each potential action, you'll see they're kind of categorized by type, and then there's a explanation for how it unlocks capital. To learn more about this, click on the link in the chat, which allows you to download the PDF and visit the other resources from the convening. And please note, just a really important emphasis, these are the draft recommendations. Many participants at the convening are actually going to take part in helping to review and support synthesis of these recommendations and these opportunities in a report that's going to come out next month. But I want to, as part of this readout for everybody, share some of the examples of the concrete recommendations to sweep the ice, so to speak, to clear the friction points for capital. Really, really important part of it. And yes, if you're starting to see, Michelle, thank you so much for that chat. If you're starting to see things that resonate with work that you've done, with ideas that you have, examples of things that have worked and also things that have not worked, put those in the chat as well. And know that in a minute, we're going to provide opportunities to see how you want to get more involved and share your work. So a lot of great kind of recommendations that came out about how to address those barriers. We just didn't talk about the barriers, and Lord knows there's plenty of conferences and plenty of spaces that we all go to in our work, all of us, right? Where we talk about the problems with not enough kind of spaces to actually build the relationships and the trust that are necessary for us to then start talking about solving those problems together. And that's a little bit of what you're seeing on the screen here. If you go to the next slide, I want to open it up now to kind of questions. Any maybe 3 or 4 minutes to see if there's any kind of questions. Grace, if there's not any kind of questions, I think I'm going to proceed to our next steps, just given our time, but I want to pause and see if there's anything, remarks from the audience, especially those who didn't attend the convening who want to learn more about the readouts.
Not at this moment, Rishi. We've mainly had folks sharing resources with each other. So thank you for that. And we'll be sure to gather all of those together at the end.
Excellent. Wonderful. Well, let's move on to the next slide here, which is really now getting a sense of for everybody, both those who attended the convening and are on today's call, and especially those who didn't attend the convening but are on today's call. What are concrete opportunities going forward? First, it's really seeing the first action or opportunity is to endorse that you share this common purpose, to unlock and align financing and capital flows for the places, populations, and programs that need the most. That doesn't mean that you need to that this common purpose is your only purpose in your organization or your work or community, but it is that this is a common purpose that you support in some way, shape, or form, minor or major. That's the first concrete action. And what I'd love to do is as a test, just to see if those on the line here today are actually resonant with this common purpose. And if the answer is no, that's totally fine. We appreciate you listening in and learning today. But let's get a sense, actually. If you are aligned with this common purpose, go ahead and just either give us emojis here, with your emoji of choice, or put a +1 in the chat now. What I'm hoping to see is volumes of emojis and +1s in the chat of those who align around this common purpose, because the first common action to take is to agree that we actually share a common purpose. See some +1s, check out the emojis. Wonderful. Really wonderful. So if that common purpose resonates with you in one shape or another, the next thing that we recommend is a concrete action from to think about how to align with and support this common purpose, and more importantly, how this kind of common space that we're a part of can support you, is to visit the Social Needs Investment Lab site to be able to download some of those innovations that were shared before the convening and to even view some of the draft recommendations. Even before the full report comes out, we wanted to, as quickly as possible, be able to share. This is not about a formal report going to a funder and then waiting 6 months for a big report and then letting that sit on a shelf and waiting for a 3-year action plan. We need new ways, right, to get past this, because we have a sense of urgency to be able to move on the things that we have when it comes to capital. So check out the innovations and the draft recommendations that have already been shared. We're making that available so everybody can take a look at that. And if something sparks, if something kind of resonates with you, feel free to reach out to us and we'll connect you with a person who had that innovation. As importantly, if you have an innovation or idea that was not showcased here or was not part of this that you think is relevant to new ways to unlocking financing and capital, contact us today. And the way to do that is to complete the survey. So I'm going to actually tee this open to see if we can launch this, put the survey link here. Yep. And unlike most webinars where we say, please complete the survey afterwards and look for it, and then we, of course, all see the drop-off rate of those who actually have time, we're going to use 3 minutes now to invite all of you to actually click on the link. Bobby, if you don't mind actually just modeling that, click on the link so it shows on the screen for the survey form. No, sorry, the link in the chat to the survey form. Perfect. This is a link that I invite all of you to be able to open up now. And if we could just take 3 minutes, please, to start to complete it. If you finish it in the next 3 minutes, great. Even if you start it, that'd be wonderful so that you can complete it ideally before the bottom of the hour or by the end of the day. That'd be great. What we're going to ask here, as you can see on the screen, is what are ways that you need or you need help to unlock capital or financing? And more importantly, are there ways that you want to both stay informed or even get more involved in helping support this common purpose? Please take those few minutes now. And as you're doing that, we'll start to see some of the responses come in. I wish I thought of this earlier, but I should have got some music ready so we can like play in the background as people are completing the survey. And how about this? As folks are starting to take the survey, just give us an emoji to tell us that you started taking the survey here as well. Just want to see if there's engagement. Thanks, Jeremy. Thanks, everybody. Wonderful. A lot of good emojis. Elizabeth, thank you. Excellent. Excellent. So thank you for completing the survey form, or at least starting it right now. Give it another minute here. And then Bobby, you can go to the next slide here. And again, if you're not able to today because you're dialing in by phone, etc., this survey will be sent out after the webinar as well, so you have time to do it. Please do complete that because it's our way of understanding how to either how much this resonates with you, your organization, your work, and more importantly, how this common space that we're talking about can help support you and connect with others. So I think I'll mention this one last thing here, and Chelsea, I'll do this together with you as well as with others who are at the convening. I've spoken to some of you about this. The broader question is, given what we validated in our hypotheses at the February convening, that there clearly is a hunger for learning about innovative solutions, for paving the way for innovative solutions by connecting with others, by thinking together about how we can tackle the infrastructure barriers that are preventing our innovative solutions from spreading. Given that there's a hunger for this, what kind of support do we need, all of us, to help us work together better with this common purpose? And so what we want to propose, and Chelsea, I'm going to indicate this is a conversation we've been having, and we've been having with a couple of other partners and would-be partners in this kind of work, is the next slide here. When we're looking ahead, I want to pose this question because we've already passed the kind of the gates of certain hypotheses. Let's see if there's hunger or appetite to push even further ahead. And ask ourselves this question: what would it take to help unlock and align $10 billion in new capital and financing for health equity? That question might seem for some like a stretch, or it might seem for others like the exact kind of most pertinent question right now to help us align our purposes. Regardless of how it resonates, I want to share with you that HealthBegins and our partners, in conversations with some of you on the line here as well, are forming an ecosystem of support. The working title for this, you see on the screen, a coalition for health equity investments and financing. And working in collaboration with and elevating the work of our partners and really thinking about how to serve as a neutral platform and catalyst. How do we help connect practitioners and policymakers and researchers and community leaders to address these systemic challenges that block capital? And how do we create a gold standard together for the kinds of standards we need in industry and practice? How do we help support convening, not just at a national level, but in different regions and communities, so that healthcare, public health, and social sector and finance folks and government and private sectors can kind of come together to unlock capital? And then how do we serve as a core partner to support this broader movement that I think we're all really starting to realize that we're a part of right now to unlock capital, but also to forge a new political economy of health. If this is of interest to you, that survey form will be a place to indicate your interest. Chelsea, I don't know if you want to share any kind of comments on that as we round out in the last few minutes.
I think you wrapped it up perfectly, Rishi. I think the only thing I will add is, we've talked a lot today, obviously, about the conversation that we had and the acknowledgement of the work that we know is happening on the ground, just that we heard in that room, but that we've all been involved in for years. I do think the power here is to step one, just double click on something you said, Rishi. Figure out what's out there, what's working, and tie it all together. I put this in the chat, but an analogy that I heard today that I really loved was we're all touching multiple parts of the elephant. We just can't see each other around it. And I think that's so true for so much of the work in these spaces, but particularly this. So step one is being able to see each other. And so, as you're looking at these resources and the document that Rishi shared out of the meeting, one, identifying the work that either you're doing or is happening in each of those buckets, I think would be super helpful so that we aren't inadvertently not including it or recreating the wheel. And two, what hasn't worked? Like talking about overtly what hasn't worked and why. And was it a lacking of the intervention? Was it a buy-in problem, or was it the current environment at that time that wasn't working? So it may be worth it to try again. I think those are all pieces of being able to see each other around the elephant, and I think it's really necessary to have that humility to say what we don't know and that we want to figure it out. So really taking apart the often territorialness that comes in spaces out of scarcity and out of not sharing resources and breaking that down so that we can actually get to work together. So I just want to name that. So thank you, Rishi, for creating the space to do that.
Thank you. Bobby, let's go to the next slide here and say, if what we're sharing is of interest, obviously complete the survey. That's the main way to let us know that you're interested. Your support is kind of the first lever to kind of change this. Your ideas are the first lever to kind of really change the structure that we need. And then to round us out, let me take one last slide here before I turn it, Grace, to you to round us out and to say thank you for those who were involved in helping make that convening happen in February, as well as everything that came from it. Bobby Long, Fred, Claire, Liam, the co-chairs and facilitators, including Jim Hickman's online today, as well as Jake Siegel, Nicholas Stein, to the student co-chairs from UC Berkeley School of Public Health, Isabel, Devin, Lana, to Claudia Williams, to Dean Michael Liu, as well as to the sponsors for the event as well that you see here. My deep gratitude. We made progress, and that progress would not have been possible were it not for everybody on the screen that you see here. Next slide. Grace, bring us home.
My pleasure. So thanks again for this discussion, which just feels like a jumping off point for so much more. So we are going to be sending the recording and the slides out to you along with some of the essential links that you saw come up in the chat. Look for those in your email later today. When the webinar closes, you will see a survey pop up on your screen that is the same survey that you saw just a few minutes ago from Rishi. It's there in case you missed it, and we really value your input there. Finally, this is an ongoing conversation. It's almost just beginning, so let's keep it going through Blue Sky and LinkedIn, and we look forward to seeing you in conversation and on our next webinar. Thanks so much, everyone.